So we're going to just get started right away. And again, we're going to talk about biomechanics specifically at the office. So again, not a lot of lifting or a lot of manual labor, but this is more working at a desk, working in an office setting. So what we're going to talk about is not just, I'm not going to really talk about how you should set up your workspace, each individual specifically, but I'm going to talk about some of the real common conditions that a lot of office workers have, why they have them, and then some stuff obviously that you can do to help alleviate your symptoms or prevent them altogether. So the three most common complaints, and I'm seeing a lot of this because I'm in my office is 2 blocks from here. I'm in a heavily office, I'm in an urban setting, so I'm seeing a lot of office workers. I'm seeing a lot of this stuff: headaches, chronic lower back pain, chronic hand and wrist pain. So we'll start with just an overview of headaches, and then we'll come back to it. So there's really 2 types of headaches. There's a lot of different types of headaches: migraine headaches, all the way down to tension type of headaches. But really, there's 2 that are coming from sitting at a desk, staring at a computer screen. One is you're getting headaches from eye strain. So really, it's as you stare at a computer for a long period of time, your eyes begin to fatigue. You'll start to maybe see that your eyes are getting bloodshot. That'll lead to headaches. And the other is poor posture. And what I mean by that is, as you start to sit and you start to slouch your head forward, it's like if you take a bowling ball, put it on top of a broom handle, and you hold it straight up and down. It's fairly easy, not that it's easy to hold a bowling ball on top of a broom handle like this, but it's easier to hold it straight up and down than as you start to lean it forward. As you start to lean it forward, you really have to fight it back, and that's kind of what you're doing with your head. You're leaning it forward. The muscles in the back of your head really have to start firing or pulling on your skull to bring it back into a neutral position. That can lead to shoulder pain, then neck pain, and then eventually headaches. Lower back pain is generally caused from prolonged periods of sitting, and it's exacerbated by sitting incorrectly, having your chair at the wrong height, sitting cross-legged. A lot of people will tuck one leg up underneath of them and sit on it that way, leaning to one side. Slouching is obviously the worst. And then wrist pain is generally caused by a lot of repetitive hand motion, and typing is what gets the really bad rap here, but it's typing, it's writing, it's filing, it's anything where you're doing something with your hand over and over and over again. Before computers, it would be machinists do a lot of this with one hand, and they would get a lot of wrist pain. It can manifest itself as hand pain or even numbness and weakness in the hands, and we'll talk about that a little bit. So now we'll go back to headaches and talk a little bit more specifically about them. And this first type of headache, again, is caused by strain on the eyes. So basically what happens is you're focusing for long periods of time, your eye muscles begin to fatigue. The eye muscles in the muscles in the eye are very small. They fatigue out, especially when you're concentrating, and then you'll begin to get headaches due to this. And generally the type of headache that you'll get is at the temple, so at the side of your heads, and then behind the eyes. These type of headaches, really there's only one way of relieving them, and that's stop doing the offending activity, or stop staring at whatever you're staring at, or stop concentrating. And really what you need is every 1 to 2 hours, a 2 or 3 minute break. Look away, close your eyes, just stop focusing for a couple minutes, and then you can go back to what you were doing. I put optometrist and ophthalmologist on there. These are the professionals you want to see for this. You want to make sure your eyes, your vision is good. And then for anything that's persistent, if your vision's been checked out, if you're taking the breaks, then you want to really get a thorough evaluation, especially if this stuff is continuing. Other type of headaches, poor posture headaches. Again, it's due to muscle strain in the back of your neck. What you'll begin to feel is tension in the back of your neck, and then into the top of your shoulder as well, and then into the back of your head, so kind of the base of your skull. And the pain will travel from there, and it'll kind of feel like it's wrapping around to the front of your head. It can be one side or the other, or both sides. And again, what's best to do is to get out of that position. So if you're in this position, every 1 to 2 hours, get up, stretch, move around. I'm not saying you have to take 3 lunch breaks a day, but just move around for 2 to 3 minutes, get yourself out of that position, and then you can go back to what you were doing. There's some specific neck stretches that we'll talk about. I think we'll have enough time She's doing a couple of them here, but we'll talk about them a little bit more in depth when I get finished. Self-massage, or actually massaging the muscle, is a good idea as well. If symptoms continue, obviously you want to get a professional evaluation or professional massage therapy, especially if the symptoms are continuing after some of this stuff, after you're trying some of this stuff. Lower back pain. Lower back pain is among the most common medical conditions that anybody presents to any doctor for. It's always in the top 2 or 3. Sitting increases the pressure on the discs by an amount of 4. So if you're standing up, there's X amount of pressure on the discs of the spine. When you sit down, there's 4 times as much pressure. When you sit down and lean forward, lean your weight forward, there's twice that amount. So there's from standing to sitting slouched over, there's 8 times more pressure on your spine. And the tendency is to, when you first sit down, to sit in a pretty good position, to sit upright. As you go on, as you're working, as you're distracted, you start to slouch more and more and more. And that's when that break of 2 minutes really helps, is because you get out of that position and then you can go back to a more neutral or more ergonomic position. Obviously, the one on the left with the X is bad, and the one on the right is perfect. Nobody ever sits perfect all the time. It's impossible, but there's a couple things that the guy on the left is doing wrong. One, his head is way far forward of his shoulder, so all the muscles in the upper part of his neck are really straining to kind of pull his head back. 2, the guy on the right has this little bit of a reverse curve in the lower part of his back. And that's good. That's pulling pressure off of the disc, which are represented as the empty space between the blocks, which are the vertebrae, in the little diagram. In the diagram on the left, you can see that he's pushing his spine forward. He's putting all the pressure on the discs, and that's where that increased pressure in the discs comes in. Everybody knows that herniated discs, bulge discs, whatever, are bad. This is one of the reasons that they can happen. And again, changing position, standing, stretching, moving around is important. Stretching the legs, which not a lot of people think about, but the hamstring attaches pretty much the same place as the big low back muscle. So if you stretch the hamstring, it actually takes pressure off of your low back. A lower back support is often pretty good. You don't need a specially designed low back support usually, but a rolled up towel or a pillow or something you can stick right in the small of your back won't keep you up in a perfect military position for the whole time that you're working, but maybe it'll take you from doing this. If you put it back there, it'll bring you to here, and that might alleviate all of your symptoms. Self-massage is often very helpful, especially for muscular type of pain. Anytime you have leg pain, which is sciatica or anything shooting, any kind of radiating pain, you want to have that checked out pretty much immediately. That can be a little tricky. You don't want to try to manage that yourself. Prolonged symptoms, especially if you've tried some of this stuff, should obviously be checked out professionally.